Good morning. Good morning to all of you. So, so all of you welcome in the Cardiacon 2024. So let's start the session. First session is by Dr. Ujjwala Baxi. The topic is impact of daily meals on diabetes and heart problem. She is practicing as a dietitian at Mumbai. So welcome ma'am. Please Dr. Ujjwala Bakshi. Welcome to Cardiacon 2024. Please come on the dais. Okay.
Thank you, ma'am. Thank you so much, ma'am, for the introduction. So, my today's topic is very practical because जो हम खाना खाते हैं उसी के बारे में हम थोड़ा discuss करेंगे. And diet is actually all about खाना खाना. And जो हम खाते पीते हैं नहीं खाना चाहिए वही सब discuss करते रहते हैं. Now, I always start my session or talks with the one quote that the food we eat can either be the safest form of medicine or the slowest form of poison. Okay, and it is up to us what we choose to eat and feed ourselves. That implicates our health and also longevity. So on that note, I will start sharing my content for today. Okay, so the topics that I'm going to share are all research based. One is the Indian dietary patterns associated with type 2 diabetes and heart problems. The second topic is diet and risk of IHD, snacking behaviors and association on metabolic risk factors, the effect of flax seeds, very importantly, because even if somebody is not including such kind of functional foods on a daily basis, but how it really matters when it comes to diabetes and heart problems. And eventually I will sum it up and conclude the entire presentation. I hope to finish on time. So the first one is the Indian dietary pattern associated with type 2 diabetes. So like this is a frequently asked questions, like the patients who suffer with diabetes, they would ask like, why is it that we are so prone to diabetes? Is it our food? Is it our genetics? And what is it that we are really, because even the Western culture is such that they, or the Chinese people, the Southeast Asian population, they eat a lot of noodles. The Western culture eat a lot of breads and pastas. So how come we are exposed so much to diabetes and heart problems? So here we are going to define and figure out what really matters with respect to the diet and the impact of it on diabetes. So this is a research that was done and published in the Journal of Neuroscience in July 2020. The objective of this study was to check the association of different dietary factors with glucose levels and lipid values in type 2 diabetes from part of a large nationwide trial. So this is a total it's a big study that was done, research was done, and it was pan-India, done in 4 union territories, including 17,285 individuals surveyed for dietary factors. Now let's move on to the survey questions. And it included subjects both from rural and urban areas. So these were the various questions on which the subjects were analyzed and figured out whether their food impacted their diabetes and heart problems. Okay, so first thing was to figure out whether they were eating breakfast. So whatever come may, the frequencies, the number of meals that one has definitely impacts the health status. So this was really important because we know that in general population, consuming or skipping breakfast is a concern. Okay, not everybody eats breakfast, and if they were to, the composition of breakfast is definitely, we know, is mostly poha, upma, or else bread, butter, sandwiches. So what really impacts and how much of it is actually leading to diabetes and heart problems? How often they eat the fruits, okay, as snacks or in the main meals. What were the frequencies of drinking dairy products? This is something that was quite fascinating, and this is a very important research based on the topic that I'm sharing today, because this really opens a lot of facts about how our daily diets, be it vegetarian, non-vegetarian, impacts our health. Okay, now the next thing that they surveyed upon was also about the non-vegetarian meat protein and the protein sources. How does that impact on diabetes and heart problems? Does that have a positive impact or a negative impact? And even if we were to just look into the basic food groups like the carbohydrates, proteins, fats, sugars, fruits, vegetables, so oils, we have to also look into the junk food, which sums all of this up. So we may not have a special category in our daily calculations that, okay, junk food, but eventually the food, the macronutrients do get converted into junk food if we were to really start looking into it. So burger, chips, pizzas, which are not actually a part of Indian diet typically, but they have created a lot of space in our daily routines, and that has also started impacting our health on a big in a big way. So let's look at the so that was the frequency. If you go to see, that was the frequency, how many times in a week that was checked with all these subjects based on rural and urban areas. And if you go to see the impact, now the impact is quite significant. So wherever you see the asterisk or the star mark, is that particular factor had a significant impact on the blood variables. Okay, so let's look backward. So first thing, skipping of breakfast. So if you go to see, skipping of breakfast really actually did not have a significant impact on the fasting blood glucose and the postprandial blood glucose. So if somebody were to ask, if a diabetes patient asks that, what about if I skip breakfast? Is it going to affect my blood sugars? As per the research, it says no, because it was not significantly impacted. But yes, those who were having pre-diabetes and those with normoglycemia, that means they were not in the range of diabetes or pre-diabetes, their blood sugars also got affected significantly in a negative manner. So when it says significantly, that means the skipping of breakfast had caused a rise in fasting blood sugars as well as postprandial blood sugars. Likewise, now we move forward to the less intake of fruit. So there were, the survey asked whether you were consuming one serving of fruit a week. That means a cupful, about 100 grams to 150 grams, and eventually 1 to 3 servings a week. Now, somebody who has consumed at least 3 fruit servings a week had shown actually rise in the blood sugars, okay, and it was also seen that it actually impacted the diabetes and the pre-diabetes. So fasting blood sugars and the postprandial blood sugars did increase if somebody was consuming lesser fruit. Okay, just one serving of fruit in a week or 3 servings of fruit in a week instead of consuming 1 to 2 servings of fruit in a day. So if somebody is consuming lesser fruit intake, definitely the blood sugars in all the 3 parameters, the diabetes, pre-diabetes and normoglycemic individuals did actually get affected negatively. Now we all know fiber plays an important role in managing diabetes, heart problems, and the less fiber intake, which is lesser than 40 grams in females and 35 grams in males, did impact. If you go to see, all the 4 parameters are high apart from the pre-diabetes. So less fiber intake actually did not cause any negative or significant impact on pre-diabetes. But yes, it did have a major impact on the postprandial blood sugars, on the fasting blood sugars in diabetes individuals, and it significantly also impacted the fasting blood sugars of pre-diabetes individuals, but it did not cause any impact on the pre-diabetes individuals' postprandial blood sugar. This is quite alarming, because if a pre-diabetes individual does not consume so much of fiber or adequate fiber, it has shown that postprandial blood sugar did not get impacted negatively. So this is something that was quite alarming and coming across in this research. Now to the meat. Now this meat is also quite a significant impact, wherein it showed that if somebody were to consume 2 to 3 servings of meat, that including the red meat, the processed meat, fish, chicken, in a week, it actually caused negative impact on diabetes. So if somebody is a non-vegetarian consuming frequently the non-vegetarian food, of course the type of non-vegetarian food chosen definitely is quite important. But here we are talking about meat specifically, and if somebody consumes more than 3 servings a week, it does cause a surge in blood sugars, postprandial, fasting blood sugars, postprandial. Now this is because, not because of the protein content itself. This is also because of the processing, the way the meat has been processed. If it is processed meat, it is going to have a negative impact on diabetes instead of having a positive impact. So we know that in general, people nowadays, what are they doing is they are consuming the meat, protein and salads as main meals. When they want to control diabetes or blood sugars, they want to control their weight. A typical urban diet pattern, because I come from Mumbai and I see patients, they by themselves, when they want to control their diabetes, they do this very typically. They just want to consume salads and protein-based salads. They want to skip the rice and the roti. But that eventually, in the long term, causes a lot of inflammation and leads to pre-diabetes and diabetes. So even if we were to follow the mathematics of carbohydrates and skip it, it is not going to help in the long run. This was the conclusion also very much from this research. Okay. Now dairy, again, dairy is a question mark kind of a food item these days, whether we should consume dairy or not, if the person has diabetes or heart problems. This research supported the fact that if consuming too much of dairy products, too much in the sense consuming 3 to 4 servings of dairy a day, okay, that means 150 ml of dairy consumption is considered as one portion. And if somebody was to consume about 500 ml of dairy and dairy products a day, this led to a negative impact on diabetes, increased the postprandial blood sugars, fasting blood sugars. Pre-diabetes also was, the person who was into pre-diabetes was, of course, had more chances to develop diabetes if the dairy consumption was high. And the normoglycemic individuals had fair chance of developing pre-diabetes if they were dependent on dairy for their protein consumptions. And of course, we know that goes pretty much heavily in a vegetarian diet. So somebody who's a vegetarian and depending on the dairy products for their protein matches, it is definitely going to impact negatively. Also because of the animal being injected with the hormones. That was also a spectrum that was showcased in this research. So one of the major factors when we speak about the meat products is the fresh red meat and processed meat was may upsurge the risk of stroke, which was also concluded in this research. So when we say that, okay, we want to increase the protein, now comes the question, if dairy creates a problem with respect to diabetes, heart problems, if the protein coming from the meat creates a problem, predisposing one to these health issues, then what should be the protein source? Because eventually we have to eat protein
Dr.
in our
Baxi,
diets.
try to conclude in within 3 minutes if possible.
Yes, sure. So we have to make sure that the protein sources has to be a blend of different food groups rather than focusing on only one food group. Yeah? Okay, now another research, this was also quite a good insightful point, mentioned that use of mustard oil had a lower risk effect. We know that it is cardioprotective and vanaspati ghee is definitely causing a lot of health issues, heart health issues. But there was another surprising fact in this research stating that if mustard oil was used for frying, actually had a lower 71% lower risk in developing heart problems. So we know that in India, the culture, especially out here in this region, Uttar Pradesh, the consumption of fried foods and actually the consumption of fried foods in various parts of the country is quite high. So if the person were to switch the type of oil, it definitely lowers the impact of on the heart health. Amongst all the vegetables, when we want to increase the fiber, it is the green leafy vegetable intake. Greater than 3 servings per week can actually prevent your heart from heart health issues. Now, snacking behavior. We all snack, we know that, and that has also led to central obesity, hyperglycemia, and hypertension. These are the frequencies with respect to different snacks that we consume on a daily basis. It can be just tea, fruits, savory products, or sweets when we use them as snacks. This is the Kerala-based study wherein the typical Kerala diet was replaced with low glycemic index foods. Okay, and if you go to see definitely the glycemic index were quite controlled, and the impact was that it did create a lower fasting blood sugars and postprandial blood sugars when consumption of low glycemic index foods was incorporated into a traditional Kerala diet. Now, flax seeds is something that may not be a part of a regular meal, Indian diet, but including flax seeds on a daily basis, the lowest dose can be 20 grams per day, has shown to improve insulin sensitivity and alpha-linoleic acid being the major bioactive compound, lignans and the fiber. So conclusion comes to that we need to consume different food groups, okay, and the quality and quantity all matters when it comes to these food groups, including functional foods like flax seeds is important, and limiting the junk foods. I hope this helps. Thank you.
Definitely helps. Due to shortage of time, we are not taking question right now.
Okay, sure.
Audience can interact with the faculty during tea break and other breaks also. So,
Thank
Dr.
you, sir.
Namrata Dixit, please introduce next.